I hope that all of you have got to see our tournament in It's been a truly innovative, exciting event because it's been multi-professional with medical students, nursing students, paramedic students, ODB students, and nurse practitioner students. International in the fact that it's represented teams from Northern Ireland, Ireland, and England, and undergraduate. So without further ado, we will progress to the grand finale. We have two very good teams who are going to show off their skills for you today. So up first, representing the University of College Cork, it's the Maple Syrup Squad. Please give them a big round of applause. Big round of applause for Maple Syrup Squad, please. Hello, all right, guys and girls, you can stand there, and as before, I will give you your pre-brief for your final scenario. Carol is your ED nurse assistant as before. So the scenario is this is ED resus room and a 36-year-old girl called Diane. You've received a standby call. She's 36 years old, only short of breath whilst out for a meal with her friends. She's wheezy and hypoxic, and the paramedics have given her a salbutamol nebulizer and commenced her on high-flow oxygen. Her relevant past medical history is asthma, 2 previous admissions to the hospital for same, none to ICU, and she is an ex-smoker. Her medications is Symbicort and salbutamol, and she has no known allergies. Okay. Are you happy with the information you've received?
She was out eating before she came in, correct?
Yeah, she's been out with her friends and become unwell.
All right, perfect.
Any other information you'd like to clarify?
Anything else, team? No? Okay.
Okay, your 10-minute scenario begins now.
Okay, everybody, if you just want to start getting to your position, we have a 36-year-old female coming in. She was having a meal with her friend. She's a known asthmatic, known exacerbations, has been to the ICU for same. Sean, you're on airway. She's a bit wheezy. She's been given salbutamol and oxygen already. Let's just make sure airway's patent and assess that as soon as possible. Nick, you're on breathing. She's said to be wheezy. Let's get another assessment of that, see how she's responding to salbutamol. Ryan, let's get wide bore cannulas sent, and let's get a full set of bloods, and let's get a beta ECG just to be sure. Okay. Nate, let's get a full set of vitals. Let's get a chest x-ray and an ECG as soon as possible, please.
Your patient has arrived in the department.
Okay. Yep.
Carol, do you mind just giving me cannulas?
Yeah, no
thank
problem.
you. So hi there. This is the team in the ED. This is Sean. He's going to just be chatting with you, okay? Just try to remain calm. You're in the best of hands, all right? Okay, Sean.
All right, hi there. I'm just going to put some oxygen on, okay? Just because I know she's a little short of breath.
Sorry, Diane. Just going to
I'm also just going to pull the shirt down a little bit here and have a look at the chest and have a feel. Okay.
So how are you feeling? Good coffee, okay.
So, as the airway patient, she's on 15-liter non-rebreather, starting at 90%.
Does not?
I wouldn't mind just maybe changing the O2 monitor just in case we might not be getting a proper read.
Yeah, let's change the position of the O2 sats, and if you're worried, let's get an AVG as well, please, Ryan. Okay, and Nikki breathing.
So I've just felt
And how are you feeling? Are you in any pain at all?
I'm just going to listen now.
Okay, fantastic.
Yeah, and I'll get back. She's very breathless.
Very breathless, okay.
Yeah, she's got a bit worse when she's come in.
She's got a bit worse. Okay, Sean, let's start with another round of neds. Let's do salbutamol and ipratropium, please.
Yeah, please.
I've got the blood pressure cuff on, and I also put on the pulse oximeter. I'm just going to take the temperature as well.
Okay, once the temperature's
and I'm just
on,
changing
we'll
the
get a
mask
full
here
set.
for you.
Temperature? Yeah, it's 37.5.
37.5, okay. So she's afebrile. She's very tachycardic. Can we get the blood pressure cycle as soon as possible there?
So we're just giving you some nebulized salbutamol there, Diane, okay?
Tommy, so there is good air entry bilaterally. There's a bit of a wheeze as well, so I'm a little bit concerned about that. There is good chest expansion. She has tachycardic and normal S1 S2 present, no added sounds for that.
Okay, we're happy with her position now as per breathing, Nikki?
So far. Yep.
Okay, all right. And so she is quite hypotensive. Guys, I'm also worried, just because she was on a meal, I'm worried that this could be anaphylaxis as well, not just an asthmatic exacerbation.
Your
Ryan,
blood gas has arrived.
Blood gas has arrived.
Yeah, it'll become on the screen.
Okay.
Do you know if any of her friends are here with her?
Her partner is just at the desk checking some details. She just said she was fine this morning and they were out and she just got wheezy.
Tommy, I'm going to continue with the rest of the
Yeah,
exam here.
and Ryan, could we get
So
some
I'm just going to feel for the
please?
tummy
Sure,
here.
yeah. And I've sent off bloods here.
And I
I sent
don't
off an
see
FBC,
anything on the
UNE,
abdomen?
a beta
No, it
HCG.
looks
We've done an
fine. She's
not
ABG. I
tender
sent off
anywhere.
blood cultures as well.
Okay with it?
Is there anything else you want?
No, that's fine.
Just a minute,
She
yeah.
looks to be in lactic
No,
acidosis
she's just a
here.
bit shut down.
And there's
Is there
no
any potential for an infection
modeling or
cause
anything
here,
of the
like
legs?
a
No, she's just a
infectious
bit
exacerbation
pale
of
and
asthma?
things, but no
It's possible. I have
rashes.
sent off blood cultures.
Okay.
We can start with broad spectrum antibiotics as well to be safe if you like.
All right. So we've done a few things, guys. Let's reassess. Sean, back to A. How's she doing?
How you doing? You still with us? Diane, you still with us?
IVT.
So she, again, her
Yeah.
oxygen saturation,
Okay.
even on nebulizers and having oxygen is at 88%. I'm getting a little concerned.
Okay.
It doesn't sound like her
Happy for
airway
me to
is,
give the
her
test?
airway is patent, but I'm concerned about maybe peripherally shut down.
Okay. And let's just go to breathing quickly.
Yeah,
Nikki?
so she was, I'll have another listen here, but she was wheezy on initial examination. And it sounds like there's still good air entry. She's very tachypnic, and there's a bit of a wheeze there as well.
Okay, so what I think is going on here is possibly anaphylaxis. Ryan, you're correct. I think we should give the IM epinephrine now.
Okay.
Because it's definitely
Okay,
C
Diane,
problem,
we're
most
just going to give you
concerning at the
something
moment.
into the leg here.
Do we have any
Not
chest
giving that
X-ray or
one.
ECG
That's not
on
how
the
you
way?
do it.
Chest X-ray has been requested. Yeah.
Okay, thank you very much. Let's also ask for the senior help in the ED to come as soon as
Senior
possible.
help has
please.
been called.
Okay.
So Tommy, I finished the rest of the exam.
Yeah.
Abdomen is all soft and non-tender. There's not any rashes or modeling on the legs. She's just a little bit pale.
A little sharp scratch in the skin there,
Peripherally shut down
Diane.
a bit.
Okay, thank you for that full assessment, Nikki. Let's, if she can, sit her up. Look for any rashes on the back as well, or on the back
Yeah.
of the legs.
Diane, would we be able to lean you forward for a bit there?
Yeah, that's
Would that be
Okay,
okay?
Tommy, the IM epinephrine has been given. Do we
And so
want to
we take a
cover
look at
with
the back. Do
antibiotics?
we
Or
see
I think
any
that's a good
rashes
idea.
there?
No, I don't see anything
Brian,
yet.
let's do as per hospital
Anything yet?
guidelines. We'll
Perfect.
cover. But I think possibly Tazocin at this point, just because I'm quite worried.
Sure, Carol has that drawn
I
up.
have it
So
drawn
Thank
up.
you very much,
Happy for me to
Tazocin.
give the test?
Yes, please. Thank you very
And
much.
Tommy, there's no rashes or anything on the back.
Okay, fantastic. Yes, please, Nate. What has been given so far?
Given nebulized salbutamol, given IM epinephrine. We've ordered chest X-ray. We have blood gases.
Yeah. The chest X-ray has just been done. We'll get it up on the screen in a minute.
Okay.
We've done an ECG as well, and we got any fluids.
Do we have fluids going
No,
in?
we haven't.
Okay, Carol, could you please give a 500 or get a 500 ml bolus ready for Ryan to give there? There's the chest X-ray, guys. She's hyperexpanded. I see that. And an ex-smoker. Okay, I don't see any worrying signs like a pneumothorax or any shift. Angles are clear. So I think this is just hyperexpansion from
that's going
an infective
through.
exacerbation of asthma, possibly complicated by an anaphylaxis as well. So let's recycle the blood pressure after we've.
Okay.
So hold on 1 second there, Sean. We'll recycle the blood pressure after the fluids and the IM epinephrine has been done. And we'll get some steroids drawn up, please, Carol.
What would you like?
Hydrocortisone.
IV hydrocortisone.
IV
Hydrocortisone, yeah.
hydrocortisone, please.
Diane,
Okay.
how are you doing there?
She just seems to be getting worse.
Soon
Should I get some IV chlorphenamine as well?
Is there anything
Yes,
that
please.
hurts, Diane?
Some good antihistamine coverage there for that possible.
No real
get some
thing. She just
chlorphenamine
very
as well,
focused worker breathing.
IV chlorphenamine?
Okay.
Yep.
Could we get a
okay.
repeat ABG? I'm just worried about her decomping.
Where's Diane? Diane,
What's your name?
sorry, I'm her partner.
Oh, hi.
I'm her partner.
With IV hydrocortisone as well?
So this is, yeah, this is hydrocortisone.
I'm gonna make it
the
we've been together a couple of weeks.
Okay, so
Just
Tommy,
for the
the
police, I really need to get over
Thank
there.
you very much,
please. I'm gonna
Ryan.
be with
All
her
right.
for a couple of weeks.
So we're just going to reassess at the airway there.
And then we'll bring you right in.
Still
repeat
breathing
ABG,
pretty
please.
heavily.
Sure, and the chlorphenamine is just
You still respond though?
So she is.
I'm worried about progression to respiratory stress, so we might want to call ICU.
We've only been
Okay, we'll put in a call, and in the meantime, Sean, can you prepare your airway kit for possible intubation in case she becomes exhausted?
Light
We'd like to
pinch
make a
here,
call
Diane.
into the ICU. We're worried about a respiratory failure and possible decompensation.
ICU has been called.
Okay, thank you very much.
So Tommy, I've just taken a repeat ABG.
Okay, and
Yeah, I'll
the
send
breathing
that
is still
ABG.
very wheezy.
She's still wheezy.
Okay, let's give another round round of salbutamol and ipratropium.
Okay, yep.
I wouldn't mind
Just
calling
go here
anesthetics
for
too,
2
in case we
seconds.
do
right
have
now,
to as well.
I called ICU. Okay, we'll do another round of the ipratropium salbutamol.
Yeah, no
What's in there?
problem.
Okay,
We're just
fantastic.
keeping them going.
And Ryan, how's that first bolus of fluids going in?
Yep, so the first bolus of fluids is going in. We've had a bit of an improvement on our blood pressure. We're up to 96 on 52.
Okay, she's still very tachycardic.
We can probably consider going with another IM epinephrine.
Yep, I agree. Okay, let's get
Been
another
about
IM.
the time, so
Okay.
perfect.
And Nate, was that her friend or? Okay.
It's just disgusting. It seems like the history that we got was pretty accurate. They were just out, she ate something, and then this happened.
Okay, give it.
No additional history. She's just gonna wait there. So once we know anything, we'll just try to.
Sorry about
Okay.
that there, Diane. Just a little bit of medicine in the leg.
All right. So in the meantime, I think maybe anaphylaxis is probably our most worrying cause right here. Nate,
She's just coughing.
what have we done in terms of anaphylaxis pathway? We've
We've given two. This is the second one. I
Yeah.
didn't see everything. So this is the second time we've given IM epinephrine.
Yep.
We've given the steroids.
Yes.
And it was I wasn't sure if it was jaundice again.
Yep.
We've given oxygen, we've given fluids, and we've done an airway assessment of the airway.
Yep.
Is there anything else that we think could be causing this, or we'd be worried about?
Did she ever choke or cough during the meal? Are we worried
Diane, you
about a
still with
possible
us?
foreign body?
We could, if you
Diane.
She's just coughing. She's just
She's just
breathless.
coughing? Okay.
Yeah.
All right. So thank you very much for that, Nate. I think we're doing everything accordingly. In the meantime, let's reassess again.
Yeah. So
Sean?
Diane, you're still okay with us? Diane? Yeah. So
Oh.
airway's still patent.
2 minutes to go. 2 minutes to go.
Okay.
Yeah.
Is there anything like a swollen tongue or
No,
any foreign
we
body?
checked. There's
Okay.
no signs of angioedema.
Okay. Thank you, Sean.
we've
Nate?
given her nebulizer.
Does anybody want to tell me what's going on?
All right.
So she's just still tachypnic, increased work breathing. Her respiratory rate has come down a little bit actually, so
Okay.
that's an
Thanks, Nate.
improvement. But she's still tachypnic.
Okay. Still a tiny bit wheezy. And Ryan?
Yeah, on circulation, we're doing we're having an improvement a little bit in the heart rate. It's dropped down to 148. The blood pressure is up to 109 on 70, so we have an improvement there with the bolus of fluids. We can the first bolus might be getting close to an end here. We can consider going with another bolus.
I think that's fine. I didn't see any fluid on the lungs. I think that's fair enough to do, Ryan. Let's get
We can get another bolus of fluid.
Thank you,
Just
Sarah.
normal saline. Thank you.
Tommy, have we gone down with the antihistamines?
We have given antihistamines and we've given steroids as well. So right now, the issue that is unresolved is the squeeze. We've given our second round of salbutamol ipratropium. Can you try to get any information about what her usual inhalers are, whether she uses any mast cell
Oh yeah, I
stabilizer or
know.
anything?
She's normally on salbutamol and Symbicort.
Okay, all right. So that's the combo there.
So we're covered then.
I'll just have another listen here.
Okay.
So Dan, we're just gonna listen to your
And
chest.
we'll
okay?
call time there. Big round of applause, please. Maple Syrup Squad, I'll ask you to go back and leave the stage from which you came and pass over your mics, and we'll get prepared for our second team. One more big round of applause from Maple Syrup Squad from Cork. Thank you very much. Okay, so up next, our next team in the final is a team of emergency care nurse practitioners, students from representing the University of Ulster in Jordanstown. Can you give them a big round of applause? Emergency care ANPs. Cue the rocky music. Big round of applause, guys. All right, team. Okay, if you would like to just stand, we'll go through your pre-brief, As before with our scenarios, the information I'll provide, you can take time, digest, ask some questions from what I have said, and then your scenario will begin thereafter for 10-minute scenario. Is that okay? You're in the ED resource room, accompanied by your ED nurse, Carol, as before. And this is a 36-year-old patient called Diane. She received a standby call because she has become short of breath whilst out for a meal with her friends. She's wheezy and hypoxic, and the paramedics have given her salbutamol nebulizer and commenced her on high-flow oxygen. Her past medical history of note is that she's asthmatic with 2 previous admissions to hospital, none to intensive care, and she's an ex-smoker. Her regular medications are Symbicort and salbutamol, and she's no known allergies. You happy with the information you received?
So, 36-year-old lady out for a meal, became short of breath, hypoxic, wheezy, and past history of asthma, and nothing else, no allergies.
Yeah. Okay, your scenario starts now.
Okay, guys, so we've got this 36-year-old lady. Can you just introduce yourselves to me, first of all?
Yes, I'm Bernice.
Bernice.
I'm Carolyn, the ED nurse.
Okay.
Helen.
And
Ronnie.
Ronnie. Okay, Helen, are you happy enough to look after the airway?
Yes, I am. Yeah.
Okay, thank you. You just go ahead there and start. And Ronnie, would you assess
What's your
B
name?
for me? You happy enough with
Yeah,
that?
I'll do
that.
Okay,
She's
and
so
Bernice, would
okay.
you mind looking
Hello.
after C again?
How are you?
I've the access for me
Sure.
and get
Find out how to
monitoring.
look at your
Yeah.
chest.
Okay, what would you
All
like
right.
to
Give us
Helen,
five.
what do you think about the airway there? Helen,
She's very wheezy here.
very easy. Would you do me a favour? Would you just check her airway and make sure there's no obstruction in there because she was eating? So there's no obvious obstruction, is there?
No
Does it look clear? Okay, so can we get nebulizers on? Can we have 5 of Ventolin and 0.5 of Atropium?
A line, yeah.
So I'd like to get 2 lines into this lady because she doesn't look too well. And then, Carol, would you mind getting some monitoring on
How are
there?
you feeling there?
Yes, that's
of course.
okay.
I'll
Thank
do
you.
that for you.
So we can get the monitoring on. So past history of asthma. I know, Carol, I'm going to ask you to do lots of things.
That's okay.
I would. First of all, Ronnie, what about B there? You had a listen in. Could
So
you hear anything?
Bilateral wheeze throughout.
Bilateral, but air entry.
Air entry is good.
Okay.
Good rise and fall in the chest wall. Good expansion.
And
Resonance is normal.
resonance on trachea central.
Trachea central.
Trachea central.
Got one good line in on
And
this
these are
side.
the numbers on the screen here as we see them.
Yep. And I'll
So
just
cycle
cycle
your
your
blood
blood pressure again.
Thank you very much. So stats are sitting there at 90, which I'm not particularly happy with.
Okay.
Yeah, she
Could
seems
we
to have got
put
worse
on
when she
nasal
came in.
specs at
Specs as
4
well.
litres as well, so we can up the oxygen intake, and those nebs are running through oxygen, aren't they?
Yep.
Oh yeah,
Not-
15 litres.
Not particularly happy with this lady's airway. So could we fast sleep anaesthetics, and could we get one of the senior docs from the ED down here as well?
Yeah, I'll
please?
ring them, that's fine.
Okay, so nasal specs are on, nebs are running. Have we got our line in?
Lines in, so
Okay.
drew off some blood. So you're
Okay.
happy enough for me to send you FBC, UNE,
Yeah.
CRP, magnesium, you want a gas?
Yes, I would like an arterial
Drew
gas, please.
Yeah, I
if
can do
that's
that.
possible.
Yep.
Could we give her 200 of hydrocortisone, please, as well, and can have 2 grams of magnesium and 100 mils of saline over 20 minutes, and run that in as well. But also like a portable.
Second line didn't work.
Could I get a portable
I'll
chest
run that.
X-ray as well, please?
Yeah, I'll ring for a portable chest
Okay.
X-ray.
So, blood pressure is sitting there at 89.55. So could we get a fluid bolus?
Yes, surely.
Just
With magnesium running through that line, we've only one in
could
at the minute.
Well, I'd ask for a second line as
We
well.
didn't get it, but we can
Okay.
try again.
Ronnie, could you try again, even if you can't get
Certainly.
one in the
you
arm
want me-
there? Maybe
try
go
this.
for the
Okay,
foot.
she's
okay.
stopped
Just-
breathing here.
Would you? Oh, okay.
No, I think she is breathing.
Is she still breathing? Is she still
Hello?
breathing?
She's
Okay.
still
She's
breathing.
okay.
Hello?
Sorry, I'm sure that's really
We
sore,
shan't
Helen. You
sting
just
you,
keep her
alright.
informed.
sorry.
Okay.
What we're
Alright,
doing.
okay.
Yeah.
Really sorry, but it's just really important that we can get these lines
Can we get a
in.
flush?
Yeah.
Feeling afraid
to take
okay. So I'd like.
Your blood
That
gas is
helps.
being
So
processed
do you
now.
want
Okay,
saline? Yeah.
thank you.
Yes, please.
Normal
Easy.
saline?
Yes,
You wanna
500
keep
mils
them
of
back
normal saline. Yeah, so is that first set of
fine,
the
yeah.
nebs finished? Okay, can we get a second set running?
Yeah,
Saline?
surely.
Okay.
So just, can we slow down 1 second and just recap? So we're still happy with A, that it's
Yeah.
clear. Our sats are still sitting very low. I'd really like anesthetics down here. We've got our magnesium running, we've got our back-to-back nebs, and we've given her some steroid as well. Is there any chance that she might have aspirated? I'm just a bit concerned that we're going down the wrong route here. So I know there's no family or history from the family that she choked or anything while she was
Not
out for her
that,
meal.
they just said she just became acutely wheezy. She's
Okay.
been fine this morning.
Okay, fine.
I'm not sure at the time.
And
Your blood gas is
And her
alright.
gas has come back.
Oh, so
Okay.
we have it. So she's acidotic at 7.3. This is arterial, is it?
Yes.
Yes.
Okay, PO2 6.5, not very happy with that considering the amount of oxygen zone. Bicarb
Doesn't seem to be
19
getting any better with all these names and magnesium.
Glucose is 8 to 3.4. Okay, so great. An acutely hypoxic patient. Okay, we really need to get those oxygen levels up. So we could put her on Ervo. So if we could get Ervo running, that would be great.
We'll need to send for the machine. Yeah, we don't have it here, right?
We don't have it here. So
but we'll get it if you want it.
Yes, I would really like to get Ervo on her and pardon? Yes, we could try an adrenaline. That's a suggestion, Helen. Anything else? Anybody from the team? Have you any other suggestions at this moment in time?
Obviously the differential here is obviously the history of asthma.
Yes.
We've had a sudden onset of deterioration.
That's what I'm a bit concerned about. Have we got our chest X-ray yet?
The chest X-ray, they've just done it. It will come up in the monitor in a minute.
Okay, and can we get a 12 lead ECG just to rule everything else out? So my concern is she's very tachycardic here. Is the first 500 ml bolus of fluids gone in? Yeah.
It's just finishing there,
Okay, could we get another 500?
Yeah,
because she's a young lady with no other past medical history.
I'll do that for you.
Alright, yeah, normal
Can't
saline,
really.
that's fine,
Yes.
yeah.
I think we can give us some
What do you think of the chest X-ray, guys? There's not really
No lip swelling or anything there?
no. Can't really
Don't
see much on
anything,
that.
no, just,
No, there's
it
no
just
big
doesn't seem to be getting any better with like, the nerves and things.
Yeah, there's no pneumothorax there that I can see anyway on that. On there. There's definitely no pneumothorax on that, is there? I can't see one. It's very hard to see. I'm happy enough, so I really want to get these oxygen levels up.
bilateral there if you're going to listen.
Yeah, but she's just really wheezy and she hasn't improved any
So
of
can we
those
give her,
nerves.
can we think of IV salbutamol?
Yeah.
Not sure if the dose of IV salbutamol off the
check
top of my
it
head.
with
I think it's
We'll
like
try
5
the
mics
BNF
per
and
kilo or
we'll
something
draw it
like
up
that.
for you, yeah.
And I'd really like to get that up and running. I'd really like to get the Ervo on because I think the peak would help her. The other thing we could try would be, she's had 2 back-to-back nebs.
Yeah. She's had adrenaline.
And she's had adrenaline neb as well. Okay.
Alright, you're doing really well.
And she's sitting up nice and high. Let's see.
We've
Doing
got
really
the bed
well.
up as high as it goes. Yeah.
Okay. Pain-wise, she's moaning there. She's sore.
She's just really breathless and hasn't
Okay.
really improved with the nerves.
Grand. And 12 lead ECG, have we got it as well?
We're just got it on there. It's just processing.
Ronnie, would you just have a quick look round and just check tummy,
Yeah,
everything?
certainly,
Just we'll
no problem.
finish off and can we
Sorry,
check
dear.
the temperature? Just
Yeah,
as,
surely.
routine
Any
as
pain in
well.
the tummy when I press on it?
Okay.
Doesn't appear to be. She's just
No.
really breathless.
From point of view of being up at the airway, you're still happy that the airway is clear?
Yeah.
Okay, good. Grand. And from a neurological
okay,
point of
Diane.
view, she hasn't deteriorated, has she?
Still
Just not getting much better.
Okay.
Anything to find in the legs?
No big red swollen calf, anything
no
like
rashes
that?
or anything?
No
No.
rashes?
Not that I
Okay,
can see, no.
so I'm a bit concerned that we're missing something here with regards to the airway and the breathing. I don't really know because I'm just, the whole eating the meal and the choking, I don't want to get caught up in that with the history of asthma, but we've treated everything for asthma and we're not really getting much
Senior help's
improvement.
on the way. I phoned him.
Okay,
Yeah.
so the
Anesthetics on her.
anaesthetics on right?
Ronnie on re-inspection of the tummy have noticed that on the screen.
Diane, I'm her
Yeah,
girlfriend.
there's
I'm
something to be this.
Alright,
So
she
she's
doesn't
got
look very well. Hello,
That's
Diane. Come on, someone tell me
Okay,
what's
so
going
she
on.
does
I'm
have
her
a
girlfriend.
It's just
Okay,
about
would you mind, Bernice,
Um,
would
Were you
you?
with her?
I was with
here.
her.
Okay,
I'm her
okay,
girlfriend.
so we've got a
She was
rash,
just,
so-
we were just eating her dinner, and she just became really short
Okay,
of breath.
so could we
Suddenly.
give her
Well, no, no,
500? Can we give her
we were just eating
500
some like
grams of
nutty bread.
adrenaline?
It was just
I
her
am,
stomach.
yes.
was
And she had adrenaline, yeah.
Do you want some
Priority she felt okay.
So
Yeah,
yeah.
she was grand. Just
Okay, and could you get me
we
10
went for a fag
milligrams of
before her.
Ronnie,
Just a wee jab in the leg
could you
here.
do me a favour? Do you mind giving that
Yeah,
lady
just
and
a
we'll
little
take her to the
while.
relatives room to try and get a bit more history of what happened?
She's possibly
I'm going to take it to the relatives room.
So we're going to give
I want to
just
leave her. She's
inject
really,
your
really
finger.
good.
Yeah.
So
bring it
you
back
can
in a
each
couple
go
of
and
minutes.
seek
Once
medical
she's-
attention.
Okay.
Okay.
Yeah,
No, no, no.
Injected your finger.
Ronnie, stay in here for me, okay?
You alright?
So will you give the 500 mics
I'm
of
not really
adrenaline?
sure how to give the adrenaline.
Okay.
Do you want to give
Ronnie,
the
will you
adrenaline?
give the 500 mics
Okay,
of
wanna give-
adrenaline? I am, please.
Okay, I'm going to give you a sharp
grand.
scratch here in
And
your
could
thigh,
you get
okay?
me,
So that hasn't worked. You haven't given that right.
give it hard, just slap it into the leg as hard as you
Help her,
can.
please. Go and help her.
As hard as you can. No, that's
No.
the other way. Turn it
Watch your
round.
finger. Other way.
That's you.
That's
That's
it now.
And can I have 10 milligrams of chlorphenamine, please?
Chlorphenamine.
IV as well. Okay, and we'll just keep going with the adrenaline nebs as well.
Okay, you're chlorphenamine,
Yeah.
alright.
Okay, and can we
Is
have,
she
we had a second,
Is she dying?
we had a second 500
Your
yard.
second sample,
Okay,
yes.
it's Bernice
Is it
back
okay if I
yet. She
stay
had her
around?
feedback.
She's all right.
You
Yeah,
want to clap her after
Okay,
taking that
just
adrenaline.
inject
Just
yourself
really
with the
worried.
adrenaline,
Oh,
yes.
okay, I saw
You're
that.
doing really well.
Right, okay, so you go and get started.
Yes.
So back to A, Helen. Happy.
1 minute remaining.
A.
Noises, still shifting air there.
What is it? So she's still shifting. Are we getting, is the breathing getting any better there at all? So she's had her adrenaline.
Same, really, you know, still very, very wheezy, very
So
breathless.
how long was it since we gave that first adrenaline?
It's only about like 2 minutes.
Okay, so we can't really repeat it for another 5. Our stats are picking up there a wee bit. Heart rate's a bit up, but I'm not surprised with the adrenaline and the nebulizers. Okay, so can we check the blood pressure as well?
Yeah, I'll
so
cycle
our
up blood
second
pressure
500
again,
is
yeah.
running.
Yeah.
Is that the second 500 in?
It's just finishing there, and I've also got your salbutamol running as well that you'd asked
Okay,
for.
grand. So we could slow the salbutamol. Well, we'll just keep the salbutamol going because that'll help expand things. And the magnesium's in as well, is it? Yeah.
I didn't, but I can give magnesium if you
Yes,
want
I'd
it as
ask
well.
for 2 grams of magnesium and 100 mils over 20 minutes.
Oh yes, she
We
did.
did
that.
that.
Yeah,
We did
that.
that.
Sorry,
We
we
did.
did.
So
Apologise.
we definitely need anesthetics down now.
I phoned them, they're on their way.
And
okay.
we have some collateral history here now, so it sounds very much like an anaphylactic reaction. So I'm happy enough that things are improving, but we need to watch it closely.
And
We
we'll
need
stop you
anesthetics.
there. Big round of applause. Well done, guys and girls. If you wouldn't mind just exiting the stage as you came on. And so, thus concludes our ASPE SimWars 2019 final. I'm sure you'll all agree it was fantastic performance from both teams. Can I ask you all one more time to give a big round of applause to both teams. On behalf of the faculty, myself, Carl, Ben, Shauna, Jamie, Leo, and all associated with SimEd Children's Hospital and SimWars Ireland, it's been a delight and pleasure to present SimWars 2019 at ASPE Conference. I hope you've enjoyed it. The results for the winners will be announced after our keynote speech in around 45 minutes time. Thank you very much. Okay, the moment we've all been waiting for. Yes. Yeah. Okay, so guys and girls, we'll just stop you there if that's okay. We'll just hold you there, Anne, if that's all right. So if you want to just and bring the court team up beside you, sure, and we'll give them one big last round of applause, please, if that's okay. Yeah, perfect. Okay, so the judges have deliberated and made their decision. Again, they would like to commend the extremely high quality of the performances, both technical and non-technical skills demonstrated impeccably from both teams. But the decision has been made. It's been a difficult decision, but it's a unanimous decision for the winners. I will announce the second place team first to receive their plaques and commendation for an outstanding tournament. So in second place is the Maple Syrup Squad from University College Cork. The winners are the Emergency Care ANPs from Jordanstown. And so, winning the prizes, which includes a one-year scholarship, a free subscription to the Association of Medical Education Europe, provided by our sponsors, AMI, and our individualized winners' plaques, and our lovely trophy for their unit. It is the winners, the very deserving winners of the ASPE SimWars 2019 competition. It's the Emergency Care ANPs from University of Ulster.